Welcome back to week 4. As you might remember, on week 2 of the course, we had an interview with Kelly Lyons. And on week 2, Kelly talked to us a little bit about her road to a diagnosis, the feelings that she had, and managing those feelings and doing support groups or blogs or internet searches to really try to help and support the way that she was feeling and the way that her loved ones were feeling and managing as well. So we'd like to thank Kelly for coming back now on week 4. And so what we're going to talk about this week, our topic in class is health and well-being. So I'll just simply start with my question for you for this interview is, do you feel healthy?
And I take pause at that question because I think healthy has taken on a lot of different meanings for me now that I have a chronic illness. I look at it physically, emotionally, spiritually. Physically, it depends on the day.
Okay.
Whether I'm healthy. I try to look at it as how am I dealing with the pain, the weakness, and then because of all the medications, the diabetes, the hypertension, the need for cataract surgery, how am I dealing physically with those things? How am I managing them? And if those numbers aren't out of control, then I think, okay, I'm having a healthy day, or I'm feeling pretty good right now, even though that healthy to me may never be what it was 4 years ago.
Okay. And I think that's such a valid point. I'll just kind of reiterate that so that everybody watching the video can kind of hear that message again. That I think so many people, when we say, are you healthy? We equate that with healthy means I don't have a disease or an illness, or I'm not having a health issue. And you said right there, I know you've had joint issues, you've had surgeries on your joints, you have diabetes, you have all of the chronic medications that you take, you've had cataract. Despite that, it's interesting to hear you say, sure, some days I feel like I'm really having a healthy day.
Right.
So I think that many people would not equate what you just talked about with healthy. So
Right.
I think that's great.
Yeah, and not keeping it just to those numbers, maybe, how you feel physically that day.
Yeah.
And, on the questionnaires, they ask you to rate it, poor, fair, good. I always take pause at that and I hate this question because it's not just about that. And then moving into the emotional health, I'm much better than I was a year ago, 2 years ago, but it's a constant work in progress so that I don't let myself fall back into those bad routines of the pity parties or the, woe is me, this isn't fair.
Okay. That's
not going to get me anywhere. So emotionally healthy, I'm much better than I was. I still think that there's a lot more to go.
Okay.
And just adapting and continuing to learn about my disease and how I'm going to manage it.
That helps you emotionally
Yeah.
to learn all of that. Okay.
And then spiritually, that's probably spiritual health-wise something that has improved the most throughout all this because I've had to rely and go back to a lot of my faith
Okay.
and my spirituality. So that's improved the most out of those 3 things.
Okay. Isn't that interesting? So I think it's delightful that when you're asked about health, that you immediately don't just think of physical health, but that you put it in the framework of physical health and emotional health and spiritual health. I think that's a great message for an audience to hear and be reminded that there is more than one kind of health and well-being.
Right.
So I think that's great. You had talked to me a little bit before about your health and well-being, and you talked to me a little bit about your disease having a purpose.
Yes.
So remind us, everybody, about what you mean by that.
At the beginning, when we were still finding a diagnosis, I thought, am I being punished? Why is this happening to me? I've had to turn that and say, no, I'm not being punished, but let's find out what is the purpose for this illness? What am I supposed to learn? What am I supposed to teach others? And doing this interview has been one way that I feel like I can give back and make use of, okay, I'm going through this, but a nurse out there who is going through this class might see something in what I'm saying, pass it on to a patient that they have and make their day or make their life a little brighter because of something that they've taken away from me. In the same way, the most recent support group that I had gotten on, this closed group that I had mentioned, I'm finding that I'm able to give maybe a little lift to someone who might not have it, and then get that, I'll get it back too, but just trying to make that, okay, I went through this so that I can tell someone else, this is what worked for me. Try this. Try to just smile, or, it's a good day if you get a shower.
Yeah.
So that someone else might not have to go through what I went through. They might be able to just pick that up and not have to go through all those feelings.
And boy, isn't it all about helping each other? If you can tell somebody or share something with somebody that's going to be helpful for them, either personally or helpful for them so they can pass it on.
Great.
Like you said about the example with nurses who might be watching this, that can take something away that's going to be helpful in their nursing practice for patients that they work with. I think what a great example. So I think my second question for this week's interview is, how have you adapted your life or your lifestyle to accommodate living with a chronic illness?
Lots of ways. The biggest thing that I've had to adapt to without choice was when I became unable to work.
Okay.
Up till that point, I was in between the surgeries, I was trying to go back to work. I even used a scooter for a little bit of a time, but just could never get past that 4-hour mark, and then was falling backwards. So once it was decided, you need to take the time for yourself and try to focus on getting better, and that whole adaptation was expected, but yet when it happened, it was still a little bit mind-blowing. So it took a little while to come up with a plan for keeping my sanity. I'm not one to sit around, so I get bored. So adapting as far as, okay, these are the things I want to try to do today. Sometimes writing them down on a list, but then having to understand that I might not be able to meet all them. Sometimes the best I can do is get up, make the bed, and get a shower. Sometimes I can do laundry, sometimes I can so adapting that list of things that I felt necessary to do each day to what I do now has changed, and just finding a positive in that. Okay, I was able to get this done, I was able to get that done. There's a lot of different ways to, I'm not sure what the word is, explain how people with chronic illness feel. One of the theories or things that people with fibromyalgia have, it's called a spoon theory.
Okay.
And that goes where you have 6, I'm not sure exactly how many, but someone with chronic illness has 6 spoons for the day. That's all they get. A person without chronic illness, they have a whole drawer full of spoons. So every time you do a task, you lose a spoon.
You lose a spoon. Okay.
So you have to really plan which things are most important, because once I'm out of spoons, I don't get any more till tomorrow. And I might not even get them all back tomorrow because I did too much today.
Right.
I've kind of changed that a little bit in my thinking. The way that it works best for me to think is a gas tank. The way that I look at it is, me with my illnesses, I get a quarter tank of gas a day, and I only get 10 miles a gallon. Whereas you would probably get a full tank of gas a day, and you get 40 miles a gallon.
Okay.
So
good analogy. I think people can get that.
Yeah, so having to plan those activities, decide which things are important, which things can wait.
Right.
How do I feel right now? Sometimes I'll look at it, okay, on a scale of 1 to 10, we're supposed to go out for dinner tonight, but I'm not really feeling good. It'll all depend on the activity. If I'll try to say if I'm at a 5 or a 6 and we're just going to have dinner, maybe I'll try it, as long as whoever I'm going with knows that I'm probably not going to be able to linger. If it's another activity like a picnic where there's a lot of activity, I might say, you know what, I just can't do it today. And having to accept that myself, that if you can't do it, you can't do it.
Right.
Because I will pay for it. Planning for things. Again, if I know that there's a picnic Saturday, I will probably do nothing Friday.
Okay.
Like literally nothing. Maybe do the dishes. Just to anticipate, and then expect that I probably won't do anything Sunday either.
Right. And isn't that probably so different if you would think back to 4 or 5 years ago? you wouldn't have thought twice about readjusting your agenda on Friday because of what you were doing on Saturday and then not planning anything at all on Sunday. I think so many of us don't even have a concept of what that must be like to have to think and plan
Yeah.
like
There,
that.
there was no thinking like that.
No.
It was go, 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 go.
Yeah.
Work all day, go out here, do that, be with friends,
You're a little
run
tired,
around.
take a nap, go out again.
Yeah.
Okay.
So, and that all just came to a screeching halt. So that is a process, and then prefacing that with people that I'm making plans with. Hey, I might not be able to make it, but I really want to.
Yeah.
I'm planning a girls' weekend in October, and kind of told them I might be able to do part of it.
Mhm.
You might just leave me in the hotel room and go out on your merry way if I'm having a bad day, but at least I'll be there.
Mm-hmm.
And just having that acceptance back from them, and if I wouldn't, then I wouldn't be planning it.
That's great.
Because I'm the only one that is going to say no to me. If someone, someone else might say, "Oh, great, you can come out." If I do that against how I'm feeling, I'm only hurting myself.
Right. Okay.
Because
Good to
certainly
know.
all my friends and family want me to be able to do the things. Sometimes I'll get some caution from my boyfriend or from my parents. My parents mostly, because they like to baby me.
Mhm.
So there's that balance on having to adapt
That's
to.
what moms and dads do.
Yeah, from being an adult child who's healthy and wants to take care of them to kind of the switch.
Yes. Yeah.
My parents retired just in time to run me to all my doctor's appointments.
So that was a big thing
A
to
big
adapt.
adaptation
Yeah.
between both of us.
Yeah.
So kind of still learning that it's okay, I can do it. You don't have to drive me here, because they worry, and
Sure.
I have to let them worry, but I don't want to get into that syndrome where, oh, everyone's taken care of. I need to still put myself out there and keep trying to be as independent as possible.
Sure. Okay. I would imagine that you lost your when you weren't able to work anymore. You lost your health insurance with that, or how does? Because I know that
will.
with treatments and with
Yeah.
physicians, and I'm thinking about this financial burden of having a chronic illness and how that must be. And we take for granted the fact that, well, I'm working and I have really good health
Yeah.
insurance, and so now I see this cycle. I can't work, and therefore I don't have insurance, and therefore what do I do? And I know that you and your boyfriend, although you've been together for many, many years and lived together very happily, that you're not married, so there's no ability for you to be
Right.
on his health insurance?
No.
Okay.
For right now, luckily, my employer has a wonderful long-term disability program. So I
Okay.
was given a year
Wow.
to stay on the health insurance.
Okay.
That will come up this fall.
Okay.
So I'll have to decide COBRA or look at one of the marketplace through the Obamacare programs. And in learning different things about this, I've also in the process of applied for Social Security disability.
Okay.
I never wanted to do that.
Oh.
Learning, that's what it's there for.
Yeah. But what a process
But what
to
a
have
process,
to learn
yes.
all that. I think
And
that's
learning
mind-boggling.
Ridiculous some of their processes and procedures are.
Really.
You have to go through an approval process. If you're approved the first time, which I think it's at 85% of people are not approved
Mhm.
the first time, then you have to wait 2 years from your date of disability before you qualify for Medicare. So there
Oh.
you are, you're sick enough that you can't work.
Wow.
You get approved for disability, which gets you some payment money-wise, but you don't get health insurance. So you're sick and you can't go to the doctor because you don't have health insurance.
Wow.
So that whole process is just mind-boggling to me, but yeah, I'll have to look through the different marketplace plans
Mhm.
and decide which one works for me, which one works within my budget. I don't want to just get married just to have health insurance.
Right. Right.
And
Not what you planned
Right,
when you were a
right.
little girl.
and his specifically has just
Oh.
changed within those marketplace plans too, so that wouldn't work anyway.
Oh. Okay.
But
Wow.
yeah, it's a whole process of trying to navigate through that system that should be easier, in my opinion,
Yeah.
than it is.
Yeah. Yeah. Okay. All right. Well, our final question for you. As a nurse, okay, so we're looking at this now from the lens of a nurse. As a nurse who's now living with a chronic illness, what would be your take-home message for nurses in practice? What is it that you really want them to remember, that you want these nurses to take away?
There are a few things, and having recently been in the hospital, as we discussed, validated some of them and brought up maybe a couple more.
Okay.
I think the first thing is that, you know, when you're getting a report on a patient or you're reading their chart before you bring them back if you're in an office setting, everyone does it because I used to do it. You see the 10 allergies and the 20 medicines and you're like, oh man. Try to look past that. I'm more than just the meds I'm on. I'm more than just the allergies I'm on. I'm more than just the 20 diagnoses that are listed on my chart. I'm a person who didn't want to have this illness. No one wants to wake up one day and their whole life be changed and everything that they thought they were going to have is different. So as that nurse, you have the opportunity, even if it's just a couple seconds, just to say, hey, I'm so sorry you're going through this. That means more than anything the doctor can write on the prescription.
Wow. What a take-home message right there. You know, I am not my chart.
Yeah, I'm not my chart. Advocating, I am thankful that I'm a nurse having this illness because I didn't give up. And the first doctor that said, oh, you have such and such, okay.
Yeah.
I didn't give up. I advocated for myself and said, no, this doesn't feel right. And maybe having the courage or the compassion to say to a patient, you know your body the best. You know your body better than the doctor, better than I do. If it doesn't feel right, keep going. There's always a second opinion. Don't give up till, you know.
Yeah. That would be very encouraging, I would think, to a patient, to have a nurse that has that compassion and some of that foresight.
Right, because it's very easy
to allow a patient to do that. Yeah.
Just to say, oh, well, the doctor knows best. The nurses, you know, they know what to do, and this just must be what's going on, when inside feeling, no, that's not right. There's something else.
Okay.
And, you know, offering that support, maybe anticipating, you know what, I'm sure you're going through a lot. Just ask that question. Do you need extra help? How are you sleeping? How are you? Just those little personal things that they may not get because everyone's just looking at that sterile chart and all their things going on. The other thing, having just been in the hospital, is that because I'm in with an acute condition, and this isn't why I was in, but say, you know, I'm in with appendicitis.
Right.
Everything else doesn't go away. In fact, everything else gets worse because I'm in with something acute.
And boy, don't we forget that. Don't we forget that as nurses. I think you're exactly right. We are so focused sometimes on what it is that is that immediate diagnosis on the chart. And if it says appendicitis, we forget about those other things.
And you might think, oh, yes, you're having pain because you just had appendicitis surgery. But if you have a chronic illness that has chronic pain, that's almost going to be doubled. Your chronic pain stays. The acute pain, they say, takes 1.5 to 2 times more medication to control because you're already on the other medication.
Right.
And your body's already used to having that intense sense of pain.
Okay.
And some readings it says you're more sensitive to it, and some it just says that it takes more to control it. So whichever way you want to look at that.
Because you've built up a tolerance.
Right.
If you're usually on pain medicine, sure,
and just
you'd
being
have
aware
that
of that
tolerance effect.
and not looking at, oh geez, now they need the Dilaudid.
Yeah.
I needed Dilaudid when I was in, and it didn't really work.
Okay.
But just
you
just the
weren't
compassion.
seeking drugs.
Right. I wasn't seeking drugs.
Yes.
I was just stated, and I'm, you know, probably said more than one time that didn't help me at all. Where someone might think, geez, that was a lot of medicine. Well, it wasn't because...
For me, I might have been asleep. Yeah.
Right. So just keeping those things in tune.
Okay.
And keeping them separate. You know, like a lot of times people are accused of seeking drugs when they really just want to get their pain controlled. And there is a difference. People that are trying to treat the pain are treating the pain, not taking the medicine to feel high. So
I think we have such a stereotype, don't we?
We do.
One of the weeks in this course, we talk a little bit about societal perceptions, and I think that chronic pain from
stigma,
whatever illness there is. I think that when people need higher doses of pain medicine, I think that the drug-seeking behaviors and things, and I think for nurses to be cognizant of the fact that this is what someone's baseline is, and maybe they're chronically on pain medication, and so I can expect that when they have an acute episode of something, they likely are going to need more. And so I think just being mindful of that would be very helpful for nurses. Good advice.
And with kind of everything I've said, the stigma, try to avoid categorizing people into, oh, they're one of those patients, oh, they're one of these patients. They're a person,
People.
individual. I'm
Yeah.
me, I'm in here, and let me out. I don't want to have this. Just kind of understanding that, I think, is the biggest take home. Just don't put them in a label and put them over here in this big group. Pick them out because they're individuals.
Yeah. What great advice, such great advice. So, again, Kelly, I can't thank you enough for coming 2 different weeks, sharing your experiences, allowing students to really see firsthand what it's like to be living and experiencing a chronic illness. You've talked about it not only from your own perspective, but a little bit about your family, losing a job, loss of insurance, all of those things and how you've managed that. So we certainly do appreciate wholeheartedly that you've come and been able to spend a little bit of time with us and share your experiences. And so I do hope that the students that are in the chronic illness class can have several messages that they can take away from these interviews that we've done. So again, thank you so much, and we do appreciate you coming.
No problem. Thank you.